Hello everyone, it's me, Dr. Whimsy, and today I am recording from my front yard in beautiful Hollywood. And I gotta say, it's a bit cloudy, which is unusual. This time of year we are starting to get the spring approaching. This is being shot, I think, about a week or two before Easter. I think it's a week before Easter and Passover. So you can feel the spring has arrived. Spring is in the air. Here comes the sun. And today I'm answering questions about how I do hormone testing in my office. And I thought it would be nice to shoot this video outside so you could all enjoy the sunshine with me. Usually when doctors ask to look at hormones from a patient prior to prescribing hormone replacement, we do a blood draw on the patient and we look at various different hormones. So I want to talk a little bit about what those hormones are and what we're looking at. We sometimes will test for FSH and LH, follicular stimulating hormone, luteinizing hormone, and those let us know if the patient is ovulating. If we see an FSH is high and there is no indication that ovulation is taking place, usually we like to test during what's known as the surge, the luteal surge, when we should see the body producing progesterone. We'll check to see if the FSH is high and if we're also getting a good progesterone level. So we check our estrogen. There's 3 types of estrogen we can look at. There's E1, E2, E3, and we check the progesterone. If the progesterone doesn't rise during that time known as the progesterone surge during the luteal phase, which, as I said, happens after day 14 in a 28-day cycle, but to make sure we get a good progesterone snapshot, we'll often test around day 19. If you have longer cycles, we can wait a little bit longer. So we look at estrogen, progesterone to see if you're ovulating. We check those levels. We check the FSH, LH, of course, as I had mentioned. And we also check DHEA, which is a precursor hormone. And that's basically your storehouse. DHEA is used to make other hormones. We also check testosterone levels. If testosterone is elevated in a female and progesterone is low, it could mean that the woman isn't ovulating. And if it's in a younger woman, it could be indicative of polycystic ovarian syndrome. Usually some imaging is done to test to see if in fact they see a cyst on the ovaries. One of the ways that I enjoy testing hormones and where I feel like I've gotten the best results is through saliva testing. I use the lab Labrix for that. And here's a couple of reasons why I like saliva testing. When a patient comes to see me and wants to have their hormones tested, I usually will hand them the kit in my office and then tell them on day 19 to take 4 samples. We want to do a sample before breakfast, before lunch, before dinner, and before bed. And so in addition to looking at their progesterone, their DHEA, their testosterone, and their estrogen, I'm also able to get a 24-hour cortisol to find out if anything is going on with cortisol. This is extremely important in my patients who are fatigued, but also in those that are having trouble losing weight. What I love about the Labrix test is not only can they take it at home in the convenience of their own home, and they don't have to be pinpricked, so there's no pain, is the fact that it's such a comprehensive test we get with the Labrix test. The other thing that's great about the Labrix test is that it's testing for what's known as free hormones. Free hormones are the ones that the cells take up in order to do work. Hormones do a lot of things. They help with metabolism. They also are growth hormones that stimulate the growth of cells. For example, estrogen and progesterone are important for bone health. This is why when women get older, we see we can see osteopenia as a consequence of that. And that's one of the reasons why putting women on bioidentical hormones is one of the things we look at when we're trying to preserve bone health. Okay, so that was a quick video from me to you about how I test in my office. If you don't want to do the saliva test because you're just too busy and you think you'll just mess it up and you just want to do the regular blood test, we can do that as well. Send you to the lab and have you do a regular blood test. Okay, that was it. It was just a quick video from my front yard and letting you see all the beautiful things we have here growing. I should probably take you around the yard to see some of the beautiful work that our gardener has done. Maybe I'll do that another day. So I want to thank you for watching. Be sure and share, like, subscribe, tell your friends. I'm going to try and answer everyone's questions about how to be healthy from 40, 50, 60, and beyond. And today I just decided to cover the issue of how I get a baseline, how I check for hormones, and from there, once I get a baseline, I'm able to, of course, prescribe the appropriate bioidenticals. Thank you for watching, and I look forward to speaking to you again soon. Take care. Bye-bye.